Hey y'all, I am back. I know I just did another live, but I'm back again with another live. And I kind of wanted to talk about this separately, just in case you didn't want to hear about my leukemia journey. So, I don't know why, but anyway. So, today is officially day 300. It has been 300 days since I received my bone marrow transplant slash stem cell transplant. And my brother was my donor. And I feel amazing. I feel great. I got to start at the beginning. Okay, when my leukemia had progressed and I was put into the bone marrow unit, I was told I was going to be there for about 28 days. I ended up staying there 40 days and 40 nights. I will never forget that because that's biblical. That's got to be something significant in that number because it was 40 days and 40 nights exactly. So, y'all, when I was placed in the hospital and I was told that I couldn't leave, all I had was the book bag that I came into the emergency room with, uh, and the clothes on my back. That's all I had. And I was confused, I was scared, I was nervous, and I was alone. I was by myself, and I didn't know how to feel. I had questions. I had a moment where I was angry. And then here it is now, 300 days later. I went through bags and bags of chemo. I went through the sickness. I went through the weakness. I went through not wanting to do anything. We were supposed to walk every day. I did have a couple of days where I didn't do anything. I did not walk. I'm not going to sit here and make it seem like I walked every single day. No, there were some days where they literally had to come in the room and check on me because they were so used to seeing me getting up early in the morning and walking the halls. So I went through being groggy. I went through being irritated. I went through I even had nosebleeds while I was in there, which is something they don't want you to go through when you are fighting leukemia and you're in the hospital. When the nosebleeds started, hello, welcome in, welcome in. When my nosebleeds started when I was in the hospital, I just went into the bathroom and I just looked at myself in the mirror and I was like, well, this is it. I was just basically just preparing for whatever may come. So when the nosebleed started, I had the nurses, they were coming in there and um they were so caring. It's amazing how some people are just meant for their jobs because here it was, I didn't know what was going on and I was just pretty much just going with whatever they told me to do. And they were so calm about it. Even though I knew that having a nosebleed was not good for me at all. They were calm, they were on it. They, relayed the messages to the next nurses. That was when they was changing shifts. And they did everything they could to stop that nosebleed. And it eventually stopped. Hello, hello, welcome in, welcome in. Anyway, so So while I was in the hospital, um, I dealt with emotional issues. I dealt with feeling physically weak. I felt spiritually weak. I just felt very vulnerable. That's why I tell people to this day, if you ever want to be humbled, the hospital will humble you quickly. I had moments where I was so upset because I didn't have a moment of privacy. I just didn't have a moment. Um, so it was just odd being in a situation where you feel like doggone it, they telling me to rest, but then again they're telling me to go take a walk. They're telling me the physical therapist is gonna come in, um the actual counselor is gonna come in, the PAs are gonna come in, the doctors are gonna come do their rounds every single morning. They did not skip a beat. They did their rounds every morning. And that was just them prepping me for the actual bone marrow transplant, stem cell transplant, however you want to call it. So they were prepping me by giving me all this chemo. Oh my goodness. When I tell y'all, I started naming the bags of chemo. I had already named my IV pole thing. I named her Shaka because when I first came in, they had to give me tons of blood and fluids. Um, and it was just so much going on. It just reminded me of Shaka Khan and her big hair. So I named my IV pole Shaka Khan. Shaka Khan went with me everywhere, to the bathroom, for my walks, to the little exercise room. I named my IV pole. So I remember being on so much chemo that I started to name the different bags. I had one bag of chemo that they had to come in with it covered, and it was in a darker bag. And that was the one that I called the vampire bag. That was my vampire bag of chemo because that was the chemo that was actually really sensitive to light. And when they came in, it was a little scary at first when I first started actually receiving my chemo, because when they come in, they have to get suited up. On the bone marrow unit, everybody's always suited up, masked up. Everything is sanitized to the T. Even when your family members come in to see you, they have to stop at this station and they have to wash their hands. They have to put on a fresh mask. They have to put on this paper gown. They have to put slip covers over their shoes. It's just a whole process just for somebody to come and visit you. And only one person can come in the room at a time. So uh, that was a little irritating also, because like if somebody did come and visit you, they had to like take turns. Um, what else? It was another. Well, when they come and give you your chemo, it has to be more than one nurse. It has to be like two nurses because they have to make sure they're matching up everything. So what they'll do is they'll call off your your medic number. Sorry, y'all, your medic number, and then they'll ask you your name, and then they'll look at your band. So it's like they have a certain protocol that they do to make sure. I had a hiccups. I'm sorry, y'all, but they'll do these steps to make sure they're giving the right bag of chemo to the right patient. And they, when they call it off, the other nurse that they have in the room with them, they are checking the bag and they are checking the paperwork to make sure that everything the other nurse is saying matches up. I hope that makes sense to y'all, but they had to make sure everything matched up with the chemo. And while I was on this chemo, it was so many different types of chemo that I was on that I started Googling and researching all the different names. That's just how I am. I just, sometimes I get mad at myself for doing that, but I am the type where I just Google. When I was first diagnosed with leukemia, that was the one mistake I think I made, was when the first doctor was like, I'm going to send you to a specialist because your white blood cell count is too high. And I Googled, because I was telling him about my bruises, and I Googled bruises and high white blood cell count. And all that came up was leukemia, 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 leukemia. And my heart sank. And in that moment, I really felt really, really alone because every time I tried to express to somebody or talk to somebody about what was going on with me, I was always kind of just told it's nothing, or you're looking too much into it, or don't claim that. And but I was reading, I knew what it was. The doctor already told me my white blood cell count was too high, and our main concern was the bruising that I kept getting. I would just wake up and be bruised up. I was bleeding for no reason. Um, I was having nosebleeds, ear bleeds, you name it. So while I was in the hospital, I was Googling a lot again, and I started looking at some of the side effects for this chemo that I was on. And when I tell y'all, I was on some harsh chemo. So I asked the doctors one morning when they came in to do their rounds, I was like, why am I on so much chemo? Why is it like bags and bags of chemo? And they're different types. And they told me straight up like this: we are preparing your body for a stem cell transplant. So that means we have to wipe your cells out. We have to knock them out as fast as we can and get your new cells in your body. Oh my goodness. Y'all, I was basically in there getting depleted. And I was just fighting the best way I could. I was trying to stay positive. I was trying to keep doing my dancing on my YouTube, and but there were times when I sat in my room and I cried. There were times when um, I would just get thoughts in my head and I would just break down. And if it felt like in that moment nobody understood me, nobody even cared how I was feeling, everybody just cared about what they get out of it or what's going on with them. And I really felt alone in that moment. But as the days went on, I started feeling like, you know what, I can do this. I can do this. And that's exactly how I felt. I started feeling like I could do this. I got this. I got this. I can do this. Ain't no time for feeling pity. Ain't no time for that. You got to pick yourself up. And you got, just like you fight with anything else, you got to fight with this too. And your way of fighting is to prepare yourself mentally. I had to basically get my tough girl, um, get my tough girl on, and I had to scrap my boot scraps up. Ain't that what they call it? I had to scrap my boots up and just do what I had to do. So after I was discharged from the hospital, after receiving my port, I already had a pick line when I was actually in the hospital. And then right before they discharged me, they placed a port in my chest. And I also had, that same day, I had chemo, a lumbar puncture with chemo. So I got all that done and I came home. And y'all, when I came home, I had only a little bit of time before I had to go right back and start getting the radiation. The radiation was also just another step with them trying to just zap everything out of me. And when I tell you it takes everything out of you, and it's so frustrating to have people around you that feel like you still could do it, you could do it. Sometimes you just want everything around you to just stop for a minute, and you want to just breathe. Like, I know I could do it, but I'm weak. I don't have strength. I think people just look at me and just assume, like, that I just got it all the time. I could do it. I could do it. But sometimes I needed a moment where I could just pull myself together and not be seen as the strong one all the time. Sometimes the strong one needs a moment. And that part was pretty tough. Um, it was hard to have like my parents take care of me and stuff because it's like I'm their youngest child. So that was pretty tough to see. I don't ever want to be in a position where my parents have to take care of me. They're at the age now where I should be taking care of them. So that was kind of rough. And yeah, so I guess I'll talk about when I got the actual bone marrow transplant, the stem cell transplant. I went in, got checked in, and my brother was my donor. And I told him, I was like, you gotta promise me one thing. When you giving your cells, you gotta listen to LL. You gotta listen to LL. I'm bad. That was my fight song, y'all. I'm bad. Every time I had a procedure to go into, or every time they had to like put me through any type of like, we had to go through this thing where we had to get on the treadmill for a while. We had to do a pulmonary test. We had to do a lot to prepare just to build up for the actual stem cell transplant. So anytime I felt like I had to hype myself up, I would listen to LL I'm Bad. That was my that was my fight song. That was one of my fight songs. So I told my brother, I was like, you gotta promise me you're gonna listen to I'm Bad when you get in that chair and you getting ready to give yourself. So he said, okay, gotcha. So when I was getting ready to do my total body radiation, my brother sent me he sent me the thing showing that he was watching LL I'm Bad, and I was like, he did it. He did it for real. And y'all, so when I got checked into the hospital and was about to receive my new stem cells from my big brother, I thought it was gonna be painful, or it was gonna be like traumatic or something like that. Nope. They came in. It was like kept in this freeze type of ordeal. I don't know if it was like dry ice type of deal, but it had been frozen, and they hung it up just like they do a regular IV, just like it was a bag of fluids or something. Hung it up, hooked it up to my. I had a transfusion line. They hooked it up to my line. The nurses explained to me, okay, here you go. Here's your stem cells. And I was like, that's it? They hooked it up, and it was just like I was sitting on fluids or something. And they was telling me like if I feel any changes or whatever to let them know. So they actually sit in the room with you for the first few minutes or whatever. I don't know exactly how long they were all sitting in there, but they watch you. They were watching me to make sure I was okay. They was watching me to make sure I didn't have a fever or have any bad reactions to my new stem cells. And we was in there laughing and talking, and I was talking about my big brother, because it was just, that was a big deal for me to have my brother to step up and say, I will see if I'm a match. I will. What do I need to do, and where do I need to go? That was his response when they reached out to my siblings and to my family. My brother's response was, what do I need to do, and where do I need to go? And when they told me he said that, I was like, that's my brother. That's all I could say was, that's my brother. But it was simple. It was not painful at all. So if anybody has to go through this, it's not painful at all. But I will say that you start to feel some of the effects later. I want to say I started to feel the effects maybe 3 days after I started to feel kind of drained, really tired, kind of sluggish. But when I tell y'all it's worth it, it's worth it. Because as the days went on, um, I want to say day 15 after I had my transplant, I started feeling better. And then day day 25, my numbers started looking better. They started climbing up slowly, slowly. Some days I would go in and they would say, oh, your platelets are low, or things like that, and I would get frustrated. I'm not gonna tell y'all no story. I keep it real with y'all. I would get so frustrated if I go in and I'm feeling good, and then my labs come back and they say that I need some blood, or I need some platelets, or I need more fluids or something. Just, it was always something. And I would get so frustrated. And I remember one day I just broke down and cried. And the nurse, she was like, I think it hurt her to see me cry because they were so used to me coming in there joking and talking and everything. And I just sat in that chair and I just cried because I was just so fed up with my platelets being low. I was mad at my platelets. I was mad at my platelets. I was so frustrated with my platelets being low. And I cried and then I just asked to go to the bathroom. I went to the bathroom. I had to pull myself together and clean my face. And I went and sat back down. That's when we was in the infusion room. I went and sat back down. And that was a low moment for me. That was a low moment for me. And I was just wondering to myself, if this is gonna be the way I go, why would I have to suffer? Just, if I was basically just saying, if this is how I gotta go, then just let me go. I didn't want to suffer. I didn't want to just constantly be in pain or constantly be drained and tired and all that. But y'all, that was around day 20, I want to say, or day 20 or day 25. It was somewhere in there. And now that I look back on all of that, it was tough. It was tough. And I had my good days, I had my bad days. And I pushed myself every day to try to smile about something. I watched movies. Um, I would watch a lot of YouTube. I watched a lot of people that I was subscribed to. Some people I watched and I didn't even say anything. Some people I'm subscribed to and I don't even know if they know that I'm subscribed to them. But I watched a lot of YouTube. I watched a lot of little funny videos. I watched a lot of people start different journeys, different workout journeys, and different some people traveling. Just a lot of stuff to take my mind off of what all I was really going through. And now that I look back on it, it seems like it was just yesterday. But here it is. I am at day 300 after. Hey! I am day 300 after my stem cell bone marrow transplant today. And if y'all know anybody that's going through treatment, it's tough. It's tough. It's tough. And some people try to glamorize it or whatever, and I just tried to make the best of it. But y'all, I'm gonna always keep it real with y'all. It beats you down. It beats you down. I'm celebrating day 300. Y'all, they said when I get to 1 year, and sometimes I catch you live and I don't even say nothing. I don't even say nothing. I just sit back and listen. But you know how sometimes I have to chime in. But I'm just sitting here celebrating. This is my day 300. And those doctors said when I get first they said when you get to the first 100 days, that's when we could start looking into spreading your appointments out, and you don't have to come in every single day. Yes, I know, right? Praise the Lord. When I tell you, it feels like just yesterday when I was going through all of that, and now that I'm at day 300, I don't even know what to do with myself. It seems like it was just yesterday when I was dragging myself up out the bed, and I couldn't believe that didn't have strength to do a lot of things, and I would try to make myself um, do some of the things that I had to do. And I would tell the medical team, sometimes they would try to give me a walker or something like that. And I would tell them, and I mean this, and I'm not trying to be too holier than thou or nothing like that, but I used to always tell them, if God gave me the strength to do, let me do. They would try to assist me to walk to the sink just to brush my teeth. If God gave me the strength to do, let me do. One lady came into the room and said, I can bring your toiletries over here to the table so that way you won't have to get up too much. That was when my platelets was really low, and they didn't want me to move around too much because they didn't want me to bump myself or cause any bleeding or anything like that. And she wanted to bring everything over to my table, and I understood what she was saying, but at the same time I just kept saying, if the Most High has given me strength to do, let me do. That was one of my main things. If I can get up and go to that sink and brush my teeth, let me get up and go to that sink and brush my teeth. Hey, and I felt the same way when I had my transplant done after the process, and then I had to start going in every single day so that they could check my labs and check on me and all that. And I hated that, having to get up every morning and have my mom drive me down to the infusion room every day. I felt like, why didn't they just keep me in the hospital? Thank you. But Renee at night. So, yep, that's me. I mean, I had to tell it because I looked at my calendar, and I have wrote really big on my calendar day 300, and I was like, it's been 300 days since I had that stem cell transplant, and it don't feel like 300. But I just wanted to share with anybody who will listen that if you are going through a storm, if you're going through something where you just can't see your way out of it, please just take it one step at a time, and before you know it, you will be walking in the sun. When I tell y'all, there was some days when I just felt like I was never gonna get back to my old self. I just felt like I was just done. I was over it. I was over people being in my face. I was over people trying to help me do everything. I was over people walking in on me while I was trying to change clothes. I was over it. I was over it. And I couldn't see the sun. I couldn't see the light at the end of the tunnel. I couldn't. I had days where I just felt like, why are you still keeping me here? Just it's just too much. It was too much at one time. I kept asking questions like, why me? I thought I did everything right. I tried to be a good person. Why am I going through this? And then I thought about it. Like, why not me? Like, why not? I'm the one with the big mouth. Maybe he's using me for a reason. I don't know. But I do know that in that dark moment, I learned how to accept myself for who I am. I learned how to accept um, my nerdiness, my quirkiness, my weirdness. Um, and I actually met people that were okay with my weirdness. That was the coolest thing about being in the hospital for a long amount of time, for an extended amount of time. It's like all my life I've been different. And when I was in the hospital, it was like the tech team, the nurses, um, the even the cleaning lady who would come in and clean my room sometimes. It's like they got me. It's they. I don't know what it was. Even one that didn't understand me watching certain shows or whatever. I even caught her standing there a couple of times looking at what I'm looking at, like, oh, that is kind of neat. I know. Come on. Come on, join the nerdy crew. Come on. That's what I was telling her. Like, come on, you getting too into it. You might as well go on and join the nerdy crew. But I met people that actually like the same things that I like. Uh I actually it was one guy who was cleaning, and when he saw me studying languages, he was like, he's not into it, but he just thought it was something different. He was like, well, you don't see that every day. And he was like, he said he had kids and he was hoping that they get into language learning also. And it was just a moment when I was feeling like I needed a support system. The people at the hospital ended up being my support system. They were so nice to me, and it didn't even seem like they were like doing it doing it just because it was their job. It seemed like to me they genuinely cared, and that's the part that got me. They genuinely cared about what they were doing and their patients. It was so funny because I even had some PAs that I just fell in love with. Two in particular that I can't wait to see them again. I can't wait to just show them here I am. Because they told me, they was like, we're gonna get you out of here. We're gonna try to get you as close to your old self as possible. And don't hurt her. Hey. So I can't wait to see them again. And I don't even know if I can go on that floor without having some type of permission or something, because like I said, when I was in the bone marrow unit, it was pretty locked down. It was pretty secure, and everybody couldn't just come up in there. Um, but I will never forget those 40 days and 40 nights. That was in July of last year, because I remember it was I got admitted into the hospital on the 4th of June, on the 3rd of July that night. So it was around midnight. So you might as well say the 4th of July. Um, and here it is now, 300 days after I received my brother's stem cells, that I am doing good. I'm doing a whole lot better than I was. I feel a big difference, and I have no words. Even when some of them see me coming in there, they're looking at me smiling. I know, and that's what I was worried about when they said prepare to be in the hospital for at least 28 days. I was like, "Oh my goodness, I'm going to have to deal with like, angry people and rude people and all that." But it was not like that at all. It was not like that at all. Everybody, I would never forget the nurse that checked me in. When they told me, they said, we're going to take you up to the bone marrow unit. And they was explaining to me that once you go in there, you can't leave out. The doctors want you up there right now. And when they took me up, everything seemed so, I don't know, like I was in a movie, like I was just in a fog or something. I'm sitting here watching the people that got me up there. They all had to stop at the sink and they were washing their hands. They was getting all, putting all the stuff on. Then they draping me. I'm in a wheelchair and they was draping me and they was getting me all together to go into the other double doors. And when we got in the doors and they turned, I remember my nurse was standing at the door and he was like, come on, baby, we got you. We got you. And when they reeled me on in the room, he explained to me what was going on. He assured me that if I needed anything, he said, I don't care what it is, sweetie. If you need me for anything, you let me know. I'm here for you. And he was showing me like where my clothes were and everything, my little hospital gown. He was so nice to me. And when he had already got like the rundown before I got up there, so he already had some hey, you called me this time. so so when I got up there, he already had the rundown that I could barely talk, that my throat was swelling up on me, and that the cancer had spread um, almost 90 something percent of my body. And my white blood cell count was sky high through the roof, y'all. And when I came into the room and they was taking the wheelchair out and everything, he waited for them to take the wheelchair out. And that's when he told me, he said, I got you some, um, it was like some, I forgot what you call it. They call it magic mouthwash or something like that. And he was explaining to me how to use it and everything. And when I was trying to talk to him, I remember he just tapped me on the hand and he said, "Oh, sweetie, I know you don't have to say anything." He said, "If it hurts you to talk, don't strain yourself. But if you really, really need me, you can." He gave me the call button. He gave me a little notepad. He said, "If you feel like you really can't talk, you can write it. You can, however you gotta do it." He said, "But you don't have to strain yourself. We gonna help you get comfortable." And he was like, "We'll be in to check on you in a few minutes." He was just so nice. I will never forget his face. I will never forget how he talked to me. And then when I saw him again later that night, I said, "You must be from the South." Because he was saying stuff, Southern. He had a Southern accent. But he was so nice to me. I had a few people that were texts that I just absolutely fell in love with. They were so nice. They would come in there and check my blood pressure and everything, take my vitals, take my weight, and they would laugh at me because they would have to wake me up in the middle of the night to take my weight. And I was like, "What in the world? Why do y'all need to take my weight in the middle of the night?" And and I used to be like, I'm watching Martin now, that I used to be watching Martin sometimes, or when my fire stick came up there, then I was watching YouTube at night sometimes. But I remember some of my texts would come in to take my vitals at night, and they'll be like, "Hey, you ain't here watching Martin." And we would get to talking about Martin, or if I'm watching somebody on YouTube, we would get to talking about who I'm watching, what their channel is about, and everything. And some of my nurses, they found out that I like this series called Once Upon a Time, and they were so into it because they was like, "Oh my goodness, are you serious? You like Once Upon a Time?" I'm like, "Yeah," and I started talking about Mr. Gold and the whole cast, and they was like, I like Once Upon a Time too. Have you seen this episode? Have you seen this?" So we would start talking about Once Upon a Time. A couple of nurses up there, they loved Twilight. I love Twilight. I actually like the book better. I actually like, yeah, I like the literature better than the movie, but I love Twilight. And I found a few nurses up there that we had that in common. So that was, mm-hmm, 5-star service all the way. They were just so nice to me. And then when they found out some of the things I liked, they tried to incorporate that. They tried to use that to explain things to me. So when they found out that I like gardening and that I was so sad about not being able to garden, and they told me I might not be able to garden for like, at the time they told me it might not be for like 2 years. And so when I got ready to get the chemo in my spine, the lumbar puncture, they was telling me how it's kind of like gardening. They said, in gardening, how you have to till your soil and everything to prepare for the new plants. And I was like, yeah. And they was like, okay, that's what we're doing. We are preparing your body for your new cells. So we have to till the soil. And when they explained it to me like that, I completely got it. I got it. And y'all, I to this day I can't even get the right words to explain what all I went through, really. I went through a lot. I went through you know what and back. And it's amazing to me. It's amazing to me how in that moment I thought it was the end. In that moment, I really just thought it was over for me. And here it is, 300 days later. I'm almost at a year. And then the last visit I had with my doctor, he told me, he said, you may be able to get back to your gardening sooner than we thought. So now they're saying I may be able to start back gardening once I hit the 1 year mark. So that'll be in October. In October, it will be 1 year. So now that I'm at day 300, I have to go back to see the doctor a few more times. A little bit, not back to back, but a little bit back to back. And my appointments are going to get like stretched out more now. So, and once that happens, then I will know without a doubt in my mind that I'm getting better. I feel better, and I'm I'm just grateful. I am grateful. I didn't know. I didn't know that I would be sitting here right now saying, "Oh, this is 300 days after my transplant." But I am not gonna hold y'all. I just really wanted to celebrate my 300 days after my bone marrow stem cell transplant. I think 300 is pretty big. I think that's pretty doggone big. And I'm so happy. Um, I'm so happy that I'm here. I'm so happy that I'm here. And I told my doctor, I was like, I'm gonna be one of your success stories. When I read that he does like seminars and he does all these different studies on stem cells and the new science behind stem cells, and he's really involved with all of these programs that are trying to um, prevent all these different diseases and cancers and things of that nature. He's really involved. And when I started reading up on him, the next time I had an appointment with him, I was like, so, you're doing seminars now, huh? You're studying stem cells. So, leukemia is not the only cancer you've been working on. He's also been working on a different treatment that they are trying to get more research on that will help deal with skin cancer. And it's another cancer that they're hoping that stem cells can really help people more with the TKIs. Like I take a TKI now that's like kind of like a little small chemo pill. It's kind of chemo, but it's kind of like very. It's so small. The dose is so small. Um, and they're trying to get it to a point where people can actually be considered like in chronic phase where they would just have to manage it, or they're trying to find a way where they can do like they did with me, like knock out your old cells, the ones that are causing the issue, and replace it with new stem cells. So it's a lot going on in the medicine world these days. Medicine is not where it was years ago. It has progressed, and I'm so happy that I was a part of a study where they used a different shot. I used to do the Zarzio shot, but my counts weren't going up the way they were supposed to. So they did I was a part of a study group where they tried a different shot and it worked. So y'all, I'm here and I'm grateful. I'm thankful. And I just wanted to share that with y'all. But y'all know how I do it. Until next time, gracias por ver. Thanks for watching. Hallelujah. Hallelujah. I can't say it enough. I can't say it enough. All praise to the Most High. Y'all know how I do it. Adios. Gracias por ver. Bye.